last February, in the very first morning, in my first day in my new home, I was sitting in the recliner, sipping a cup of coffee, my first one of the morning, first one in the new house, chatting on the phone with my mom. All of a sudden, I heard a boom! That shook the room. Could feel it in my body. Mom, I've got to go. And I walked toward the front door because that's where the noise was coming from. And I opened the door. And I looked out, and across the street was a tank with a turret and a SWAT team. And the SWAT team was in full body armor with machine guns, running around the room, or not the room, the yard across the street, yelling. It was total chaos. I closed the door and locked it. And I stood there, and my heart was pounding. And I was breathing fast and shallow. What is going on? The day your patients get a big diagnosis, a percussion grenade explodes in the middle of their comfortable lives. And their hearts are pounding, and they can't breathe. And their comfortable lives have just been shattered. So back to my story. I stood at the door and I called the police because I wanted information. I was afraid. I didn't know what was going on. I wanted to know, am I safe? Am I even safe in my own home? Your medical team is like that SWAT team outside. They're a little intimidating to people watching, but your team knows exactly what you're doing. You are working together in precision. You're not missing a beat. You know all the possible outcomes. You're in control. So, back to the window, watching all of this, I see the SWAT team escorting my new neighbors. They're walking like this in only their tighty-whities. There's really not a point to telling you that. But I had to tell someone. And you know what? That scene is just something you can't unsee. And I'm sure there have been days in your work where you've seen some things that you can't unsee. So you all know that compassionate care improves outcomes for patients. They have less anxiety. They even have better wound healing. They recover faster. They just have better outcomes. That is the art of medicine, that compassionate care. The SWAT team is like the science of medicine, right? But medicine, as you know, is both an art and a science. Let's take a moment of self-discovery, okay? Ask yourself a question. This is just for you. No one has to know the answers. But ask yourself, how do I treat myself when I'm afraid? Do I beat myself up? Do I tell myself I shouldn't feel that way? Do I ignore it? Do I eat too much, drink too much, work too much? How can you possibly give your patients the compassion and care and understanding that they need if you're not giving it to yourself? It has to come from you first. You have to give it to yourself first. So let me tell you the juicy part about what we're going to talk about the rest of the day, the rest of our time together. I have resources to share with you that will enable you to be the superhero that we know you are, and ride in and meet your patient's needs in a compassionate way and in a way that honors yourself. And it won't cost you any money, and it won't add any work to your day. And once you see that, you can't unsee it.
Yeah.